You're turning 65 and beginning this Medicare journey for the very first time, or you've worked past 65 and now you're deciding to retire, and so you have to figure things out with Medicare. You've heard about a Plan G, but you don't really know what it is or why it's important or how it works with Medicare. Hi, I'm Ryan Nutter, founder and principal of Cornerstone Senior Advisors, and in this video we're going to look at the Medicare Supplement Plan G. What is a Plan G and how does it work with Original Medicare? So let's dive right in. What is a Medicare Supplement Plan G and how does it work with Original Medicare? Well, to better understand a Medicare Supplement Plan G, let's look at Original Medicare. What is Original Medicare? What does it cover? Maybe more importantly, what does it not cover? There's two parts to Original Medicare, Part A and Part B. Part A is your hospitalization. All these years you've been working and they're pulling money out of your paycheck for taxes, the portion of your taxes that went to Medicare paid for Part A. It's your hospitalization. So let's look at Part A. What does Part A cover? Where does it leave off? What are you responsible for? Well, day one, you're admitted to a hospital. You have a hospital deductible of $1,736. That's your hospital deductible. That deductible will cover you for up to 60 days. The catch with this deductible is it's not annual. So if you're admitted to a hospital, you're going to pay that $1,736. Let's say you're there for a few days and you go home. 2 months later, you're back in the hospital, you're going to pay this deductible again. So if it's a rough year health-wise, it could really ding you any given year. If you're in the hospital for over 60 days, well, now you have a per-day copay of $434 that you're paying each day that you're in the hospital over 60 days. If you're in the hospital over 90 days, now your per-day copay jumps up to $868. Skilled nursing is also under Part A of Medicare. Skilled nursing is basically a place to recover. So if you have a life event like a heart attack or a stroke, or let's just say you had your hip replaced, once your doctor says you're stable, but maybe you're not quite ready to go home, they oftentimes send you to a skilled nursing facility essentially to recover. So you'll have registered nurses taking care of you, and this is where you'll have your physical therapy, occupational therapy, speech therapy, things like that until you're ready to go home. Medicare fits the bill for a skilled nursing facility the first 20 days. So you pay nothing for the first 20 days in a skilled nursing facility. So let's talk about Part B of Medicare. What does Part B of Medicare cover? And maybe more importantly, what does it not cover? Well, when we talk about Part B, first of all, it does have a premium tied to it. So this is your first premium. You are going to be paying $202.90 per month for Part B of Medicare. If you're drawing Social Security, they are just going to take this $202.90 out of your Social Security check automatically. They're not going to ask you otherwise. That's paying for Part B of Medicare. If you're not drawing Social Security, then they're going to bill you quarterly. They're going to send you a quarterly bill where you're paying the $608.70 every 3 months for Part B of Medicare. Down the road, when you do begin drawing Social Security, they're just going to automatically change it to where they're deducting this premium from your Social Security check. But until that point, you're paying quarterly. Before we move on, I do want to mention this premium can be higher based on income. So for some of the higher income earners, this premium does go up. For more information on what you might be expecting to pay on Part B of premium, you can check out a video that we have on that. Most people are paying $202.90 per month. So what does it cover? Part B, everything outside the hospital. So again, it's your primary care doctor and your specialist, your emergency room, even outpatient procedures are under Part B of Medicare. Part B of Medicare has its own deductible. This is separate from your hospital deductible. It's $283. And it works differently from your hospital deductible in that it's annual. You're just paying this deductible one time a year. So anything outside of the hospital, you pay the first $283 with Medicare. Once that deductible has been paid, now Medicare kicks in and they're going to pay 80%. You're going to pay 20%. So anytime you see a healthcare professional, you're paying 20%. Again, your primary care doctor, your specialist, your outpatient procedures, you're paying 20%. The big issue with Part B of Medicare is you have no max out of pocket. So if you had a health condition that comes up where you're going in for regular treatment, regular and often, let's say you end up with cancer, you're going in for chemo, radiation, you're going to keep paying 20% and there's no stop loss. There's no ceiling to what you could end up having to pay out of pocket. All of these costs with your hospital coverage and your outpatient coverage under Part B, all of these costs are why we have Medicare Supplement Plans. They're also called Medigap policies because they fill these gaps of Medicare. So what the government did is they designed this chart. There are 10 Medicare Supplement Plans. And they told all these private insurance companies, if you want to offer a supplement to Medicare, you can, but it has to be one of these 10 plans the government designed. So that's called the standardization of plans. And what that means is these insurance companies, they cannot design or make up their own supplemental insurance to Medicare. They have to choose from this list of which plans they'd like to offer, which the government designed, and then they can decide how much premium they'd like to charge. But coverage-wise, we're going to look at the Plan G. Well, a Plan G is a Plan G is a plan. It doesn't matter which company you're getting that Plan G from, they didn't design it. They all have to abide by the government's rules. Pay how it's designed to pay, cover how it's designed to cover, but they're all going to charge different premiums. So each individual we are able to walk alongside and helping them understand their Medicare benefits. We're going to look at each of the companies that offer this Plan G, and we're going to look at how much premium they charge so you can make a very informed decision. So a Plan G, when you combine a Plan G with Medicare, what does it look like? How does it work? So under Part A, you're admitted to a hospital. Day one, this $1,736 deductible, that Plan G pays it for you every time. You don't have to worry about it. Your per day copays, those are covered for you. If you end up in skilled nursing, any days after 20 days, instead of you having to pay that $217 copay, that Plan G is going to pay that for you. When you combine a Plan G with Medicare and you end up hospitalized, you're essentially just going to receive a statement of benefits paid. Dynamite coverage. Outside of the hospital, you have this $283 deductible. You do have to pay that. The Plan G is not going to pay that $283. But remember, it's an annual deductible. You're only paying this once a year. Once you've paid that deductible, well, now Medicare kicks in. They're paying 80%. You're paying 20%. The Plan G is going to kick in. They're covering your 20%. So when you see a healthcare professional, once you've paid off that deductible, again, all you're going to receive in the mail is a statement of benefits paid. The Plan G is really dynamite coverage. You have no network. Any healthcare professional in the U.S. that takes Medicare is also going to take this Plan G. It's nationwide coverage. Also, you don't have a private insurance company dictating your care. Whatever company you get this Plan G from, they are secondary to Medicare. Medicare is primary. So if Medicare pays any part of a bill, then this supplement has to kick in and pay. They don't have a choice. So you have no network, you have a $283 annual deductible, and that's it. Dynamite coverage. Now, if you have further questions or if you want to dialogue on what Plan Gs cost in your area, what companies offer a Plan G in your area, give our office a call. We'd be more than happy to help. We have a dynamite team that's very service-oriented, that's very easy to work with. Our goal is to simplify Medicare so you can make an informed decision. Also, if you'd like a copy of my book, Medicare Made Simple, you can reach out to us on our website, advisemedicare.net, or call our office at 316-260-3331. We'll ship you out a free copy of this book where we dive into Medicare, supplemental plans, Advantage plans, all things Medicare in this book. I hope this video was helpful for you. Thanks so much for watching.